A 32-year-old woman found herself facing a worrisome health concern. She had always had regular periods, but this time something was different. Her menstruation was unusually heavy, causing her concern. She had been experiencing mild cramping in her lower abdomen, a symptom she hadn't experienced before. Adding to her worries, she had been diligently taking oral contraceptives for the past 3 years. Despite her consistent use of birth control, she decided to take a pregnancy test. To her surprise, the test came back positive. Confused and concerned, she scheduled an appointment with her family physician. Her doctor listened attentively as she described her symptoms and the positive pregnancy test. He ordered a transvaginal ultrasound to get a clearer picture of what was happening. The ultrasound revealed an empty uterine cavity, meaning there was no pregnancy within her uterus. However, the ultrasound also showed fluid in her rectuterine pouch, a space behind the uterus. This finding raised red flags for the physician, as it could indicate a serious condition called an ectopic pregnancy. He immediately referred her to the hospital for further evaluation and treatment. The unexpected turn of events left the woman feeling overwhelmed and anxious. What was supposed to be a routine checkup had turned into a race against time to diagnose and address a potentially life-threatening condition. She couldn't help but wonder how a positive pregnancy test was possible with heavy menstruation and what an empty uterine cavity meant for her health. To understand the complexities of the woman's condition, it's crucial to delve into the intricate process of implantation. Implantation is a remarkable biological event that marks the beginning of a pregnancy. It's a carefully orchestrated dance between the developing embryo and the mother's uterus. Around 6 to 10 days after ovulation and fertilization, the fertilized egg, now called a blastocyst, travels down the fallopian tube and into the uterus. The uterus, in preparation for pregnancy, has undergone changes under the influence of hormones like estrogen and progesterone. The inner lining of the uterus, known as the endometrium, becomes thick and nutrient-rich, ready to receive the blastocyst. The blastocyst, a tiny ball of cells, burrows into the endometrium, a process known as implantation. This intricate process involves a complex interplay of molecular signals between the blastocyst and the endometrium. The blastocyst's outer layer, called the trophoblast, plays a crucial role in implantation. It releases enzymes that help it penetrate the endometrial lining. Once the blastocyst is firmly embedded in the endometrium, it begins to release hormones, including human chorionic gonadotropin, or HCG. HCG is the hormone detected in pregnancy tests. The successful implantation of the blastocyst is essential for a healthy pregnancy. When implantation occurs outside the uterus, as in the case of an ectopic pregnancy, it poses serious risks to the mother's health and requires immediate medical attention. While the process of implantation is underway, the developing embryo undergoes remarkable transformations during the second week of gestation. The blastocyst, now firmly embedded in the uterine lining, continues to divide and differentiate. During this critical week, the blastocyst transforms into a bilaminar embryonic disc consisting of 2 distinct layers of cells, the epiblast and the hypoblast. These layers will give rise to all the tissues and organs of the developing baby. The amniotic cavity, a fluid-filled sac that will surround and protect the embryo, begins to form. Another crucial development during week 2 is the formation of the yolk sac. The yolk sac, connected to the developing embryo by a narrow stalk, plays a vital role in providing nourishment and circulating blood in the early stages of development. As the embryo grows and develops, it forms finger-like projections called chorionic villi that extend into the uterine lining. These villi will eventually develop into the placenta, the organ responsible for exchanging nutrients and waste products between the mother and the developing baby. The second week of gestation is a period of rapid development and differentiation for the embryo. These early stages lay the foundation for the formation of all the major organ systems in the weeks to come. However, when implantation occurs outside the uterus, as in an ectopic pregnancy, the embryo cannot survive and the mother's health is at risk. In a normal pregnancy, the blastocyst implants within the uterus, allowing the embryo to grow and develop safely. However, in some cases, implantation occurs outside the uterine cavity, leading to a condition known as an ectopic pregnancy. Ectopic pregnancies are relatively uncommon, affecting about 2% of pregnancies. The most common location for an ectopic pregnancy is within the fallopian tube, the narrow passageway that connects the ovaries to the uterus. Other less common sites include the ovary, cervix, and abdominal cavity. When a fertilized egg implants in the fallopian tube, it's known as a tubal pregnancy. The fallopian tube, unlike the uterus, is not designed to accommodate a growing embryo. As the embryo grows, it can cause the fallopian tube to rupture, leading to life-threatening internal bleeding. Ectopic pregnancies can occur due to a variety of factors, including damage to the fallopian tubes. Scarring or inflammation from previous infections, such as pelvic inflammatory disease, can block or narrow the fallopian tubes, making it difficult for the fertilized egg to reach the uterus. Women who have had one ectopic pregnancy are at increased risk of having another one. Assisted reproductive technologies like in vitro fertilization and other fertility treatments slightly increase the risk of ectopic pregnancy. Ectopic pregnancies are serious medical conditions that require prompt diagnosis and treatment. Early detection is crucial to prevent life-threatening complications. Diagnosing an ectopic pregnancy can be challenging because the symptoms often mimic those of other conditions, such as a urinary tract infection or a miscarriage. In the early stages, an ectopic pregnancy may not cause any noticeable symptoms. As the embryo grows, however, women may experience first abdominal pain. The pain may be sharp or cramping and is usually located on one side of the lower abdomen. Second, vaginal bleeding. The bleeding may be lighter or heavier than the normal period and may be accompanied by clots. And third, shoulder pain. This unusual symptom can occur if blood from a ruptured fallopian tube irritates the diaphragm, a muscle involved in breathing. If a woman has any of these symptoms and suspects she might be pregnant, it's crucial to seek medical attention immediately. Early diagnosis and treatment are essential to prevent serious complications. To diagnose an ectopic pregnancy, doctors typically use a combination of methods. First, medical history and physical exam. The doctor will ask about the woman's symptoms, medical history, and any risk factors for ectopic pregnancy. Second, a pregnancy test. A blood test can detect the pregnancy hormone HCG, which is produced at lower levels in an ectopic pregnancy compared to a normal pregnancy. And third, a transvaginal ultrasound. This type of ultrasound provides a clearer image of the pelvic organs, allowing the doctor to visualize the location of the pregnancy. If an ectopic pregnancy is confirmed, prompt treatment is necessary to prevent life-threatening complications. Section 6. Navigating the treatment options for ectopic pregnancies. Treating an ectopic pregnancy depends on several factors, including the location of the ectopic pregnancy, the woman's overall health, and her future pregnancy plans. Treatment options can range from medication to surgery, each with its own benefits and risks. Methotrexate injection. This medication is often the preferred treatment option for early-stage ectopic pregnancies, especially those located in the fallopian tube. Methotrexate works by stopping the growth of the embryo, allowing the body to naturally absorb the pregnancy tissue. This option is typically offered when the ectopic pregnancy is small, the HCG levels are low, and there are no signs of rupture. Laparoscopic surgery. This minimally invasive surgical procedure involves making small incisions in the abdomen and using a laparoscope, a thin, lighted instrument with a camera, to visualize and remove the ectopic pregnancy. Laparoscopic surgery is often the preferred option for larger ectopic pregnancies or those that have ruptured. During laparoscopic surgery, the surgeon may choose to remove the entire fallopian tube, known as a salpingectomy, or only the portion containing the ectopic pregnancy, called a salpingostomy. The choice of procedure depends on the extent of damage to the fallopian tube and the woman's desire for future pregnancies. The decision of whether to pursue medication or surgery is a complex one that should be made in consultation with a healthcare provider. The doctor will discuss the risks and benefits of each option, taking into account the woman's individual circumstances and preferences. Section 7. Understanding the risks and long-term implications. Ectopic pregnancies, while treatable, can have both short-term and long-term implications for women's health. Short-term risks. The most significant immediate risk associated with an ectopic pregnancy is rupture, particularly in the case of tubal pregnancies. Rupture can lead to life-threatening internal bleeding and requires emergency surgery. Other potential complications include infection, damage to surrounding organs, adverse reactions to medication, and emotional distress. Long-term implications. The long-term implications of an ectopic pregnancy can vary depending on the treatment received and the extent of any damage to the reproductive organs. Future fertility. One of the most significant concerns for women who have experienced an ectopic pregnancy is the impact on their future fertility. While some women go on to have successful pregnancies after an ectopic pregnancy, others may face challenges conceiving. Risk of recurrence. Having one ectopic pregnancy increases the risk of having another one in the future. Emotional impact. The experience of an ectopic pregnancy can be emotionally challenging, leading to feelings of grief, loss, and anxiety. It's important for women who have experienced an ectopic pregnancy to receive appropriate medical care and emotional support. Talking to a healthcare provider or therapist can help women process their experience and make informed decisions about their future health and family planning. Section 8, The Patient's Story, A Brush with Danger. The 32-year-old woman whose heavy menstruation and positive pregnancy test raised alarm bells found herself facing a life-altering diagnosis, an ectopic pregnancy. The fluid detected in her rectuterine pouch during the ultrasound was a telltale sign of internal bleeding indicating a potential rupture. She was immediately admitted to the hospital, where a team of medical professionals swung into action. A laparoscopy confirmed the diagnosis, a tubal pregnancy in her left fallopian tube. The embryo had implanted in the narrow tube, and the growing tissue had already caused some bleeding. Due to the location and the risk of rupture, the medical team recommended immediate surgery. During the laparoscopy, the surgeon carefully removed the affected portion of her fallopian tube, a procedure known as a salpingectomy. The surgery was successful and the internal bleeding was controlled, preventing further complications. The woman's relief at the successful surgery was palpable, but the experience left an indelible mark. She had been unaware of the dangers of ectopic pregnancies and the importance of early detection. The fear and uncertainty she had experienced during the diagnosis and treatment were emotions she would never forget. Her story serves as a stark reminder of the seriousness of ectopic pregnancies and the need for vigilance, especially for women in their childbearing years. Section 9. The importance of early detection and intervention. The case of the 32-year-old woman highlights the critical importance of early detection and intervention in managing ectopic pregnancies. Early diagnosis can be life-saving, preventing potentially fatal complications such as fallopian tube rupture. Women play a crucial role in early detection by being aware of the symptoms of ectopic pregnancy and seeking prompt medical attention if they experience any unusual vaginal bleeding, abdominal pain, or other concerning symptoms. Know your body. Be familiar with your menstrual cycle and any changes that occur. Irregular bleeding, spotting, or bleeding that is different from your usual period should be reported to your doctor. Listen to your body. Pay attention to any unusual pain or discomfort, especially in your lower abdomen. Don't dismiss pain as normal period cramps, especially if it's severe or persistent. Don't delay seeking help. If you suspect something is wrong, don't hesitate to contact your healthcare provider. Early diagnosis and treatment are essential for a positive outcome. Healthcare providers also play a vital role in early detection by maintaining a high index of suspicion for ectopic pregnancy in women of reproductive age who present with relevant symptoms. By working together, women and their healthcare providers can increase the chances of early detection and successful treatment of ectopic pregnancies, ensuring the best possible outcomes for women's health.